Pertussis, also known as whooping cough, has shown some dramatic increases here in California. Dr. Christian Sandrock is Yolo County's Deputy Public Health Officer, and he's here with me today. Dr. Sandrock, exactly what are we seeing with this disease?
The last year for pertussis has been one of the higher years as far as, prevalence of the disease in California, which is really a combination of a few things. A little bit of it's the lack of vaccination in certain groups within California. So younger kids are not getting vaccinated, which is, having pockets of outbreaks, usually in school systems and with school children. The second is that our immunity as we get older wanes, so it gets less. So at some point when you hit your late teens into early adulthood, that immunity goes down and makes you more susceptible for disease, and that extends out through your adult life. So if someone doesn't get a follow-up vaccination in those later years, from the late teen years onward, they become more susceptible to disease. So that sort of combination of some small pockets of younger kids being able to spread disease in school, then bringing it home to adults and, early adulthood people who then are more likely to get the disease is increasing the burden in our community.
Who should we be the most concerned with about contracting this disease?
The people who are most at risk of having bad outcomes with pertussis are the really young. So, usually within the first 6 months to 12 months of life. And that's particularly because after those young kids are born, they don't really make their own antibodies. And if their mothers don't have adequate antibodies to pertussis and haven't been vaccinated that second time, they then are in a window of getting severe disease and dying from the disease.
Now, what about the chances of severe outcomes for older children and even adults?
Usually in an average, older child and an adult, the likelihood of it adding as a death is very remote. So for most of us, it ends up being that, you have a sore throat, you have a cough, and usually that cough progresses to what we call a severe paroxysmal spasm cough, where you just have these coughing fits where you cough extremely hard. Sometimes people will throw up after they cough. It is so severe. Other times they just have severe periods of coughing, watery, runny eyes, very difficult time with breathing. Younger kids can have a little bit of wheezing and what we call stridor, difficulty breathing because their vocal cords and their pharynx is a little bit swollen and irritated. But for the most part, it's really just severe, the severe paroxysmal coughing.
Dr. Sandrock, what advice do you have for Yolo County residents on how best to protect themselves from pertussis?
The advice for parents is basically get vaccinated. So both get your kids vaccinated as part of that routine schedule, but then as you get older, you yourself should be vaccinated if you haven't been since, that time in childhood. And most, family practice docs the community docs are very good at keeping up with that, and they'll vaccinate you and recommend it, usually with your tetanus shot and with other boosters now. They're pretty good at staying on top of that. So the key to that, though, means get yourself your own doctor. So now that we're all moving towards, cheaper and national, full coverage of healthcare and how that's transitioning, people should be able to get some access that they can get these vaccines pretty readily and be able to vaccinate themselves as well as their kids.
Well, here's another question for you. Is it ever too late for an adult to get a pertussis vaccine?
So for adults, it's never too late technically. So the vaccine was studied up until age 60. So that's sort of what the package insert has as an approval timeline. Now with that, and that's kind of what the general recommendations are. With that being said, many doctors still will vaccinate, when they're 60, 70, and 80 and older. You don't get the same antibody response. It's not been studied in that subgroup as much, but I think they're still at risk for getting disease, and I think it's still reasonable to vaccinate people. I have with my older patients. So general public, get vaccinated, both older and younger people. So have your first vaccinations as scheduled, second vaccinations as part of booster.
Well, that's great advice. Thank you, Dr. Sandrock, for filling us in on pertussis. And for more information on pertussis, vaccinations, and other public health resources, be sure to visit us online. Just go to www.YoloHealth.org for more helpful information. Thanks for watching, and stay well.